So we say a very welcome hello to everybody who's just joining us. You're more than welcome to this, our annual conference on the Sustainable Development Goals. And we always hold it in the week of the UN Global Justice Day. And this year we're lucky enough to be able to hold it on the exact day. So today is the UN Global Justice Day. And we're glad to be presenting the latest edition of Measuring Progress, the Sustainable Progress Index. And this basically looks at Ireland in the context of progress it's making on the Sustainable Development Goals and how it's comparing to its peer countries in Western Europe, the sort of 14, the EU 14 as they're known. So I'm not going to delay in any way with the introductions. We have a very capable team here to be able to sort of expand, who have prepared this report and who are going to present it for us. And first up is Professor Charles Clark from New York. He is a professor in the Department of Economics in St. John's University in New York. And without any more ado, I hand over to him, as he's more than well known, particularly to people who come to this particular seminar each year, as he's been doing this work for us since we began it way back when the Sustainable Goals were first announced back in 2015. So over to you, Charlie.
Thank you so much, Seán, and I'm glad to be in Ireland, if only virtually. I was actually in the room when the United Nations voted to make World Justice Day, and so didn't know it would have such an impact on my life going forward. But we're glad to be doing these reports because I think that they're very important. Next slide. So to give you an overview, I'm going to give some context to the issues of not only well-being, but why the traditional measure of well-being, GDP, is increasingly being questioned and supplemented, but not rejected or replaced completely, but supplemented. And then Dr. Catherine Kavanagh will present the results of our Sustainable Progress Index based on the Sustainable Development Goals indicators. And then Colette Bennett will provide some conclusions and future policy considerations. This whole exercise and all these statistics are collected and analyzed to inform policy. So to undertake it without having that part would sort of defeat the purpose. Next slide. We can go to the next slide again. Okay, so when the idea of well-being is sort of like the hot issue now in public policy analysis, but it's always been central to public policy analysis, and measuring for well-being has always been. It's just the well-being of the elites were the only ones who were considered. You know, it was even Adam Smith who said that government is formed to protect the property of the rich against the poor. And so we look at the governments before Adam Smith, they were measuring things that they thought were important to their own well-being, not necessarily for the public as a whole. Now, Adam Smith suggested that government should do three basic things which would benefit the well-being of the average person. One of the revolutionary parts of Adam Smith's analysis is placing the consumption of the average person at the heart of his analysis, instead of the gold that would go to the king and to merchants. And so Adam Smith suggested that the state should do three basic things. One, provide for national defense. The second, to provide for justice, would be law and order, including the protection of private property. And then the third, to provide public works and institutions that are beneficial, but not profitable for private industry. And the examples he gives are roads and canals, which clearly are beneficial for the economy. But he also mentioned later on education. So he clearly saw that that was part of a dynamic economy technological change is a big part of his analysis. But the heavy work for helping improve people's lives in classical economics was going to be a dynamic market economy which increased production so that people consume more. And that was the key. All consumption was only there, all production was only for consumption. And so he was a strong believer in laissez-faire. He didn't think the government should get involved in micromanaging the economy, but that the economy needed things like infrastructure, roads, canals, that wouldn't be profitable for the private sector. And so that would help the market economy be more dynamic. Next slide. When we look at the first attempts at measuring the economy, we see, after William the Conqueror conquers England, he sets out to measure everything so he could figure out how to maximize his taxation. Another famous example is William Petty with the Down Survey. After Oliver Cromwell conquered Ireland, they came over to measure the economy and property so that they could steal the best parts for those who participated in the invasion. Governments measured other things, but national output really wasn't important until we get to World War II. So before World War II, we would have some people trying to conceptualize how we would measure it, but it was really World War II that forced GDP into public policy planning. And that is, in order to plan war production, they had to calculate what could be total output, and then how much could they give to the war and how much is necessary for private consumption. And John Maynard Keynes's book, How to Pay for the War, really puts this in the forefront. And the United States follows that example. John Kenneth Galbraith was the person in charge of the war economy in the United States at the time. So GDP became an important part of government planning. Then after the war, it was important for maintaining full employment. Keynes's whole analysis is based on the idea that aggregate demand often will be insufficient to provide for full employment. And so the government needed to have a role, fiscal and monetary policy, to try to keep aggregate demand at high enough levels so that we would have full employment, and full employment provided for maximum economic growth, which meant the most output for consumption. So we're back to Adam Smith's. We're concerned with GDP as a measure of progress because GDP is our proxy for how much are people consuming. Next slide. And of course, eventually general problems start to arise with GDP as a measure of well-being. And this is noted by the earliest developers of GDP in the 30s, even before the war, that they are very leery of this being a measure of well-being. But it became the primary measure, particularly because it promoted what businesses wanted. Maximum output production meant maximum business activity, maximum profit. So it was a way that you can satisfy the business interest as well as promoting full employment for workers. But GDP doesn't distinguish between what is helpful and what is harmful, such as crime and earthquakes are good for GDP, but clearly they're not good for the general public. It ignores many contributions that are significant and necessary for an economy, such as home production, childcare, taking care of the elderly at home, etc. And it turned pollution into something that was good. That is, pollution came from activity that was always added as a plus, when in fact pollution should be then subtracted somehow, because it clearly is a cost and not a benefit to society. Ireland has special problems in using GDP, not just as a measure of well-being, but just as a measure, period, because it's so detached from its own real economic growth. And this has been noted a long time. When I taught in Ireland in 94, 95, I went to a meeting of economists in Dublin, and they were talking about how much is GDP overvaluing the economy back then. But we can see from this graph that up until around 2014-ish, Ireland, the black line is percent of GDP. So it's over the average of the EU countries, but just a little, and then it just completely takes off. Next slide. So that we see in our table to the left that Ireland is second in our 14 countries at 84, really just almost 85,000 euro. 179% of the average of our EU 14 countries, which, anyone who has any experience in living in or visiting any of these countries would know there's something wrong here. If we look, we see in the right-hand columns, we have consumption, which is what we're really interested in for GDP as a measure of well-being. How much consumption are households able to undertake? And we see that Ireland is practically at the middle. It's 10 euro above the average. And that's where we would expect it. And to the right, we have a scatter diagram with consumption and GDP. And we see that all but two countries are right on the trend line, with Ireland and Luxembourg just outliers completely. And so if we want to use a measure of aggregate economic activity as a well-being measure, we shouldn't use GDP in the Irish context. We should be using something like final consumption. But again, then we still have the other problems because we're not distinguishing between helpful and harmful consumption. We're not looking at inequality. This is average consumption. It could be that some are consuming a lot and a lot insufficient. And it's not measuring the non-market activities, which are very important. Next slide. Okay, so the issue of GDP, really in the 1980s, you start to hear people talking, and then the 1990s, GDP as being disconnected from well-being, is that as the economy is growing, as the country is getting richer, the average person is not feeling it. This is a famous article of the GDP is up, why do I feel down? And we have here, using the Social Progress Index, which we'll talk about in a minute, but it's one of the most popular measures of well-being. We break down the countries of the world into the categories of the World Bank: high income, middle income, and low income. We combine the low and low middle income because there aren't that many low countries anymore. And then the upper middle income is a separate group, and then high income. And we see that as GDP goes up, the effective GDP in increasing the Social Progress Index becomes less and less. So I've highlighted that on the table over here, that with a $1,000 increase in GDP, low and middle incomes, their average Social Progress Index will go up by 4.2 points. The upper middle will go up by 1.9 points, but high income countries will go up by 0.2. And if we only took the OECD, the rich, really rich countries, then that would get even smaller. So if the goal is to raise the well-being of citizens in high-income countries, then economic growth or just getting GDP to grow isn't going to be sufficient. Next slide, please. Next slide. So we're going to look at so the report looks at some of the popular measures of well-being. In this table, however, we have just a summary of some of the more important work on well-being. The Stiglitz-Sen report, which we went into details last year, lays out the various factors that are very important for well-being. The first one, material living standards, that's the only thing that GDP captures. And then we have the World Health happiness report, and then the well-being in policy. It's a very extensive work that's being done in the UK on how different aspects of well-being, how effective they are. And only a small part of that is in terms of GDP. So well-being, yes, it has an income effect, but health, education, very important social connections, safety, individual safety, whether people have a political voice, whether they feel connected to the governance, and then their work and their participation. All these are very important for promoting well-being. Next slide. So the biggest, I think, index is the Social Progress Index, and that's put out by the Social Progress Imperative. They were one of the first ones, but they clearly are well funded at 60 variables. It was led by Michael Porter, the famous marketing professor. And what's good about their approach is, yes, they have the aggregate score. So you can see that in 2022, Ireland came in 13th overall. But then it's very easy with their analysis. They provide all the data to break it down. They have three basic categories: basic needs, foundations of well-being, which is mostly education, healthcare, and then opportunity, which is about rights and freedoms, inclusions, and that sort. And then of course there are 4 or 5 variables for each of these subgroups. So there's 4 or 5 subgroups, and then a bunch of variables. So you really can get into the details, and why that's important we get to at the end, but that allows you to look at what it is policy might want to address. Okay, next slide. The World Happiness Report has been getting a lot of press, and it's, who doesn't want to be happy? But the World Happiness Report is put out through the United Nations, and what they do is they take the World Gallup poll, the Gallup World Poll, and they ask at least 1,000 people in each country various questions which are designed to measure how happy they are. And so we can see in the table are 14 countries, and Ireland's right pretty much in the middle, a little above the average. And so they do this, and it's a 3-year cycle. So the data 2019 to 2021 would be the results that we're looking at right now. But then they look at, well, what explains that? What are the factors that explain those results? And then it's straight econometric analysis of some objective variables like GDP per capita, and life expectancy, but then some subjective variables which are based on the same poll: social support. If I need someone's help, do I feel confident that friends of mine will help me? Questions like that. And so they break it down into how much each of these factors contributes to the overall happiness in countries, and they'll do it by countries as well as overall. Our results are the average for the Euro 14. So we see income, 27%, very important. And then social support, do you have friends, connections, healthy life? Do you have freedom to make choices about your life? How much corruption do you have to deal with? And how generous is your society? All these contribute to happiness. Next slide. So this is a summary table of some of the leading ones. So we have towards the left the GDP per capita, and we can see that is Ireland's number 2 with Luxembourg. But then we look at the Social Progress Index, where Ireland's right in the middle. The Sustainable Development Report, which Jeffrey Sachs Group puts out, and then the World Happiness Report. And we see for the other three, the well-being measures, Ireland is pretty much in the middle of this group of 14, which tells us that this is a good group for us to consider in terms of evaluating Ireland's performance. Next group. Okay, so the next thing we do in the report, I'm not going to talk about it, go over it now, but we then look at each of these index, these aggregate well-being index, and COVID-19, basically to see what happens to the index and to see if if these are good tools for informing policy decisions. And the aggregate numbers generally aren't, because they're really looking back and they're good for showing general trends, but not for, if you saw your happiness score, the government isn't going to be able to say, well, we have a good idea how we can improve that. You really have to look much more at the micro aspect. And so after that, we take a brief look at the need for focused indicators. And I read the Examiner most days on my phone, and one of the popular stories I come across quite frequently is the lack of beds and hospital beds. And so we provide some more detailed statistics, comparison statistics for the healthcare system in terms of all sorts of aspects. Here we're just giving the table that looks at how much spending per capita and then how much hospital beds. So Ireland has 2.9 hospital beds per 1,000 population, which is one of the lowest. It's 69% of the overall average. Doctors are low, below the average, almost 20% below. However, nurses were above the average. So that tells us that, well, maybe we're not don't have the right numbers compared to other countries. We'd have to look and see if they have the same hospital bed shortage problem. But then I just looked in to see how long, has that always been the case? And so the table to the graph to the right, we look at Ireland's hospital beds per 1,000 from 2000 to 2019 and compare it with the EU average, EU 14 average, and we see that up until 2008, the two were very close to each other. And so there's an overall trend for less hospital beds needed because there's an overall trend for less time in hospitals after procedures. That's a good thing that we're able to treat people and get them out quicker. But then 2008, 2009, we clearly see Ireland made a decision to reduce that. And while the average has still been falling, Ireland is significantly below that average. And so this gives us this informs the current situation, and I think leads to the next set of questions to look at how are the other countries dealing with the need for hospital beds, especially in light of COVID and the other respiratory problems, epidemics that have been going around. And, time to rethink if these things are permanent, rethink these strategies. Next slide. Okay, so just to sum up, the whole reason why governments collect information is to inform policy, to have evidence-based policy. Many countries have had ideologically based policies, particularly sort of the supply side economics. Let's cut taxes on the rich, and that will make the economy grow. Doesn't really ever happen, but there's an ideological defense of that. But if an evidence policy becomes less ideological and much more based on what will have the effective results, and the evidence allows us also to measure, are we having the results, which is just important. So you can have policy corrections if you're not getting the results that you're looking for. The well-being frameworks that become very popular and widely used, they're very good for looking at the broad trends, looking at the historical context, particularly looking at factors that have been left out by just looking at GDP or just economic variables. But in terms of informing policy, you still need to get into the more detailed analysis, which some of these aggregate measures do provide, and which they are very helpful. And that's really what the Sustainable Development Goals are there for, to provide set of goals to achieve, but also indicators so that we can measure how far we are from where we want to be and to measure our progress. So it's not I read this somewhere, it's not the Olympics of social, economic, and environmental statistics, but it's a way of learning from countries that are similar to you, how possibly you can achieve better results. Once you see if other countries have a different policy to address an issue, and they're getting better results, you can learn from that. That's very important information in public policy, in the public policy process. Okay, so that's sort of the context for this whole endeavor. And now we will turn to Dr. Catherine Kavanagh.
Okay, so hi everybody.
I might introduce you first, Catherine. I was on side. Had myself on mute there. Sorry about that. Just to introduce Dr. Catherine Kavanagh. She's an economist in UCC and has been part of the team doing this study since its beginning as well. And we're delighted to have her here today, continuing her series of presentations on the actual index itself. So over to you, Catherine.
Thanks very much, Sean. And as I said, I'm going to share my screen here now with you. Okay, so hi everybody, and today I'm just going to talk you through our latest version of the Sustainable Progress Index. What I'd like to do is maybe give you a very brief overview of the data and how the index is actually constructed. And then what I'll do is I'll present the rankings by country, first of all, across 3 different spheres of the economy, society, and environment. And then I'll show you the overall index itself. Now, just to kind of, I suppose, acknowledge that all of the detail regarding the data and the methods and so on is provided in the actual report. So I suppose, as you all know, the UN adopted the 2030 Agenda for Sustainable Development in 2015, and they came into force in 2016. And the goals are based on about 169 targets across about 230 indicators. Now, Eurostat, the World Health Organization, the UN, the CSO, and the OECD, they've all actually committed to monitoring the SDGs and collecting the data that's actually required by countries to ensure that they achieve progress on the SDGs. And I suppose also since about 2016, there's been quite a bit of work done by several researchers and organizations, and even the UN itself, trying to understand how countries are doing and attempting to report on them. And of course, Social Justice Ireland, through the work of Charlie, Colette, and myself, have been tracking Ireland's progress on the SDGs since around that time as well. So the first thing we did was to examine the latest report by Eurostat. Now, Eurostat produce an annual report. It's very informative. They try to track trends and key indicators of the SDGs over time. Now, they don't actually produce an index, but their report, I think, is still of value because they attempt to track how countries are performing on those indicators. And they have roughly about 100 different indicators, and with 36 of those being what they call multi-purpose indicators, meaning that they appear under different SDGs. Now, this latest report from Eurostat says that the improvement in the achievement of the goals has occurred at different paces for each SDG, from moderate to significant. And if you see from the graphic here on the slide, there's significant progress has been made on some SDGs, particularly if you move from the right hand up to the very top right hand corner there, you'll see that SDGs such as SDG number 1 and SDG 16, significant progress has been made on those. And then, things progress in not so positive ways, we move down towards the bottom left-hand corner. And we see, for example, that SDG, as I said, number 1 and 16, you know, have shown good progress, as has good health and well-being, and certainly SDG 8, decent work and economic growth, and SDG 9. The other thing just to mention, I suppose, is there's a favourable assessment here of SDG 7, but of course that's very strongly influenced by the significant reduction in energy consumption in 2020 as a result of COVID-19 and the related restrictions on public life and I suppose lower economic activity. But certainly we see that there has been some improvements in SDG 14 and 15, while progress towards the remaining 9 goals has been much slower. And as I said, there seems to be a slight movement away then also among certain goals such as SDG 17, SDG 6 and SDG 15. Okay, so that's the Eurostat report. So then there's another body of work which is produced by Jeffrey Sachs and his colleagues in the Sustainable Development Solutions Network and Institute. And their work over the years, I think, has really complemented the work of Eurostat. And their most recent report provides country profile of 193 countries, including many of the less developed countries. Now, they actually do calculate an index and they rank each country then by how far away the country is from achieving the SDGs. They also do a nice thing, which they have country-specific dashboards, and these are produced from the data, really supposed to provide guidelines to policymakers on areas that have specific challenges. And here I'm sharing with you the most recent dashboard from Jeffrey Sachs and his colleagues. And if you see here that the color codes identify where progress has been made under each SDG, and a green indicator implies achievement, whilst then yellow, orange and red symbolize increasing distance from SDG achievement. And you can see here from the graph that for Ireland, the report concludes that we face significant challenges under SDG 2, SDG 12, 13 and 17. And 3 other goals, number 7, 14 and 16, are also classified then as significant challenges. So major challenges for 4 goals and significant challenges for 3 other goals. So I suppose the next step then is to move on to our own piece of research. And I suppose the first thing to mention is we do something slightly different, because what we do is we focus on the EU 14 countries. We're interested in measuring performance of each country relative to their peers. So countries with a similar level of development. Now the analysis does draw on an extensive data set. Our starting point is always the UN Global Indicator Framework, which has gone through various, I suppose, editions over the years, the most recent being 2022. And we also draw then on the EU SDG indicator set, because this includes indicators which are kind of more relevant, I suppose, to the EU policies and initiatives. And we try to ensure as far as possible that the final data set is closely aligned with the global indicators, whilst at the same time taking account of the EU context. Now, another of, I suppose, additional rules help us to guide our data selection. And these include, for example, relevance and applicability of the data, because they must be, the data must be directly related or at least similar to relevant indicators to ensure monitoring of the SDGs. We also try and ensure that the data is of good quality. We only use official published data from international sources and non-government organizations. Coverage has to be for all of the 14 countries. And insofar as possible, we try to make sure that the data is as up to date as possible. Now, for most indicators in our index, this is 2021, 2022 for very few. But obviously then for some indicators, it might be a little bit older. And this obviously means that certain most recent events can't be fully captured. So for example, the impact of COVID-19 is not fully captured in the results. It'll probably take a little while longer to actually really see the full effects of that. But in any case, our final data set consists of 82 indicators then across 17 goals. And I suppose the other important thing to ensure that we emphasize is that there's a minimum of about 4 indicators for each SDG, but there are some exceptions. So for example, for SDG 13 and SDG 14, there are only 2 indicators. And that really has to do with, you know, data availability and drawing on the key points that I've just mentioned there above. So I suppose the next thing then to just give you a little bit of indication is of our method. Now again, just very quickly run through this because there's a lot more detail in the report. The first thing I suppose to emphasize is that we draw very closely on the work of Jeffrey Sachs and his colleagues from 2016. And the first step in constructing the index is to rescale the data. That means making it comparable across all indicators. And all indicators are expressed in ascending order so that a better performance on any indicator will always imply a higher value of the SDG. Now, the benefit of this approach, of course, is that it allows us to benchmark Ireland across all the countries at indicator level, at SDG level, but also at the aggregate level. And following the UN and the Eurostat, each SDG and each goal is weighted equally because the goals are regarded as equally important and should be indivisible. So, as I said, we emphasize that our goals are all interdependent and interconnected, and we think that's important to emphasize, but we still think there's value in looking at the 3 different spheres here of the economy, the society, and the environment. And that's really what we're going to take a look at here now. So my first graphic of results here shows the economy index. Now the economy index is computed by combining two goals, SDG 8 and SDG 9. And what we can see here from this graph is that Ireland, of the 14 countries, gets a score which ranks it in 9th place on the economy. So this is quite an interesting result, I suppose, because if we consider some of the key drivers behind that result, first thing, as I suppose, is SDG 8. SDG 8 is, as we know, all about decent work and economic growth. And we calculate our SDG 8 based on 6 indicators. Now, obviously, what's in there is GDP per capita, and we do really well on that. Second only to Luxembourg. So that's quite a high score for us on that indicator. But we also remember we want to try and capture things like decent work. Now, there is no readily agreed measure of decent work. So we use, I suppose, proxy kind of indicators such as average wages and accidents at work to capture those. And they give Ireland somewhat a less favorable result. Ireland is actually ranked in 8th place on SDG 8 itself. But moving on then to SDG 9, which calls for building resilient and sustainable infrastructure and promotes inclusive and sustainable industrializations and so on. We draw on 5 indicators to produce our SDG 9. And just again, the key points: expenditure on research and development as a percentage of GDP is the 2nd lowest in the 14 countries at 1.06%. Also, Sweden, Austria, and Germany, perform much better on those. They're the only countries that have expenditure greater than 3% of GDP. Also, Ireland does somewhat better on perhaps the number of researchers as a percent of the population. They have been growing, and also, internet use. So when we combine, I suppose, by the way, the score for our SDG 9 is 11, so we're ranked 11th on that overall. But when we combine the 2 scores, I suppose what we really see is that despite significant improvement in many aspects of the economy, such as GDP growth, GDP per capita, our broader measure paints, somewhat of a less optimistic picture for our economy index. So now we move on to the Society Index, and our Society Index is constructed using eight different goals that you can see here on the right-hand side of my slide. And what we see here is the Society Index performs somewhat better than the Economy Index, and we're coming in with a rank of 6th place given our actual score. Now, our relatively favorable position on the society aspect is driven by particularly strong performance on the education theme, which is SDG 4, SDG 16, and also we do quite well on good health and well-being. So maybe if I just give you some sort of, again, some key kind of results from our Society Index. So for SDG 1, which is all about no poverty, we use 3 indicators there. We do quite well on the poverty rate, which is inclusive of tax and transfers, but our other measures of poverty give Ireland a less favourable sort of an outlook. So that's SDG 1. SDG 2, the main issues there's no real major issues about food security as such within the EU in terms of sufficiency and supply. However, as we know, consumption patterns and lifestyles have changed quite significantly in the EU and also in Ireland. And obesity is on the rise, which has significant implications, I suppose, for people's quality of life and for resourcing of the healthcare system. Obesity in Ireland is one of the highest of our EU 14 countries at over 25% of the population. And also one indicator reflecting sustainable agriculture is worth mentioning, and that's the organic farming. So again, there are some key challenges there with only 1.66% of the sustainable agriculture being organic, and that's again according to the EU data. For good health and well-being, we do somewhat better. Ireland scores relatively well on that overall index. There's a much better list of indicators available for good health and well-being, and it includes things such as, subjective well-being, life expectancy, indicators of smoking and alcohol, chronic diseases, and so on. So we come in at 5th place on that. Sweden, Netherlands, and Finland score highest on SDG 3. SDG 4 is interesting because, as we know, SDG 4 is all about education, and it calls for equitable and quality education at all stages of life. And I suppose the other thing to note about SDG 4 is that, it's important for meeting other goals, are achieving other success in other goals, such as reducing poverty, inequality, gender inequality, and so on. Now, this is one of the goals where Ireland scores really well. Our performance is very impressive on this particular goal. And in fact, we come in 1st place. And we're actually very good on all the indicators from, childhood education through 2nd level, 3rd level, all the way up. And there's a new indicator in there on basic digital skills. We do exceptionally well on that as well. The only one that we don't do as well on is lifelong learning. So that's maybe one area where attention needs to be diverted to, but certainly a very good performance in SDG 4. SDG 5 then is all about gender inequality. Our measure for SDG 5 consists of 5 indicators, and results here are a little bit mixed. We're below the EU average for both the share of women in national parliament and women in senior management. However, the gender gap is actually reversed in the area of education, meaning that women are ahead of men, and Ireland is ranked actually 1st on that indicator aspect of SDG 5. Some other maybe quick results to mention: reduced inequalities, SDG 10. Again, we kind of score in the middle ranking on that goal, SDG 10. On SDG 16, which is all about peace, justice, and strong institutions, Ireland is regarded as a relatively safe society with a low number of deaths associated with homicide and assault, and relative to the other EU countries, we're in 7th place on SDG 16. And the other one that I really wanted to bring your attention to, I suppose, is SDG 17. Because really, I suppose the SDGs can only be realised with a strong commitment to global partnership and communication. And our SDG 17 is computed using 4 indicators. Now, it includes ODA, Overseas Development Assistance, as a percentage of gross national income. So data is still an issue for it, but certainly the one indicators that we have give Ireland, for the ODA in any case, a ranking of 10. And that's because Ireland's performance on ODA is coming in at about 0.3%. There are other indicators in SDG 17, such as the percent of GDP devoted towards environmental taxes and the percent of expenditure on health and education. Overall, our indicators for SDG 17 put it in at 10th place. So that's our society index. Now let's turn then to the environment index. And this is really the final leg of the stool, you'd be glad to know. And what we see here in our next table is the overall score for our environment aspect puts Ireland in 9th place amongst the 14 countries. And what you can see again is, the Denmark, Netherlands, Germany, Sweden topping the polls there. Portugal and Spain and Greece tend to be the ones that are at the bottom for most of our different spheres. However, 9th place, I suppose, is still important to emphasize, means that there are significant challenges in meeting our commitment to the environment goals. And I think that was evident both in the Sachs report, but also in the Eurostat report. So maybe if I just take you some of the key findings again here on the environment aspect of our analysis. So SDG 6, which isn't mentioned here, is all about sanitation and water quality. There's significant room, I think, for improvement for Ireland on that goal, because we're ranked 11th place on SDG 6. Moving to SDG 7, there's a couple of key features I think that we need to emphasize here. First one is that CO2 emissions from energy fuels combustion is one of the highest in our sample of 14 countries. And the other thing is that the share of renewable energy is one of the lowest amongst our peers, and it's well below the EU average. In fact, the score for SDG 7 puts it in 10th place amongst the 14 countries. For SDG 11, we do somewhat better, really. Focuses on quality of life, as we know, in cities and communities. It also draws attention to things like sustainable transport. And we use several indicators to capture SDG 11. And in fact, I mean, air pollution is certainly less of a problem in urban areas in Ireland relative to other countries. We don't do as well on satisfaction with public transport. For that indicator, we're ranked in 10th place. But overall, we don't do too badly on SDG 11. I think we come in in 3rd place overall. Moving on to SDG 12. SDG 12 is all about consumption and production, which are the key driving forces in the global economy. I suppose it's always about doing more and better with less. So we use 5 indicators to capture the themes of SDG 12. And I suppose overall, we're poor on the production of municipal waste, meaning we produce a lot more of it relative to other countries. We're poor also on the recycling rate of waste and the indicator of circular material. I suppose on the plus side, resource productivity gives us a much more optimistic score, but overall we're not doing as well on SDG 12, coming in with a ranking of 10. Moving on to SDG 13, problems with data availability now for 13, I suppose, is something we need to draw our attention to, because it's one of the SDGs that international agencies are still finding problematic when it comes to attempting to estimate trends. We've only 2 indicators for SDG 13. One of them is greenhouse gases, which is one of the key Eurostat indicators. And we come in overall, when we combine that with a score of what's called the carbon pricing score, we come in at 10th place based on our score for SDG 13. So that's based on our 2 indicators. SDG 14 is all about conserving and sustaining the use of ocean, seas and marine resources. We don't do too badly on SDG 14. We're coming in, and again, data availability is an issue there, unfortunately, but we're ranked in 6th place overall on SDG 14. And in terms of SDG 15, which is all about life on land, I suppose similar to SDG 14, it remains somewhat limited because of data availability to track changes in that goal. However, indicators of the share of protected terrestrial areas and freshwater put Ireland, in quite a favourable position. The score on the red list index, which estimates biodiversity loss, is much less favourable, as is the percent of land dedicated for forestry use. It's very low relative to all our other countries, well below the EU average. And overall, our score for SDG 15 puts it in 7th place. So that's, I think, a lot of information there in terms of how we score on the different goals. And the next graph here, and again, this is obviously evident in the report itself. We can see here's our economy at ranked 9th, society is ranked in 6th place, and the environment is ranked in 9th place. And under each of those, then you can see how we score on each of the different SDGs. Okay, so I suppose what's interesting here out of this table is that there are some pluses, some positive news here. Ireland is in the top 5 for SDGs number 3, which is about health and well-being, number 4, where we come in 1st place, and certainly SDG 11, where we come in 3rd place. We also don't do too badly on SDG 14, bearing in mind there are data limitations there, of course, but we're coming in 6th place. We're kind of in the middle of the ranking for quite a lot of the other goals. And I suppose the key thing we need to draw attention to here is that some of the goals representing the environment certainly point to significant challenges still being ahead compared to how we are doing. Remember, it's all about how we're doing relative to our peers, the countries who are of a similar level of development. So now, I suppose it might be interesting to just wrap up by saying, well, how are we doing overall? How are we doing on our measures overall of the SDGs? And again, as I say, what we want to do is compare relative to our peers. And I think it's important to emphasize, and we've argued this previously, that there is really merit to presenting just one number, one statistic to capture progress, because I think it can quickly draw attention to potential problems or issues that need to be addressed. And certainly our measure here, our Sustainable Progress Index, provides a very, very simple report card that just allows us to track Ireland's performance relative to the other EU countries where we're experiencing a similar level of development. So here it is, everyone. Here's our SPI 2023. And the score for Ireland gives it a ranking of 8th place overall. And what we see is, the Scandinavian countries, once again, top the rankings: Denmark, Sweden, Netherlands, and Finland in top place. And again, we have Portugal, Spain, and Greece in the bottom of the ranking. So really, everyone, I suppose there's enough of the numbers stuff now to keep your mind fuddled for a little while. So I'm really going to pass you on now to the important work, which is what happens on the ground. And so I'm going to pass you over to Colette, who'll talk you through some very important policy implications.
Just thank you, Catherine. And just to introduce Colette, is our economic and social policy analyst with Social Justice Ireland. And she's been doing the policy implications and policy considerations, as she calls them, of what you've seen, of what you've heard already. So she'll present that when she's finished. We'll then be open to questions and answers across the system on anything that has been raised, and feel free to put your question into the Q&A function online. So over to you, Colette.
Thank you very much. And thank you to our other contributors. So as Seán said, I'm going to just very briefly, because there are a lot of policy considerations, but I'm just very briefly going to run through the various different conclusions and considerations that we would like to progress as part of this work. So obviously the SDGs are the blueprint. They're how we want to achieve that better, more sustainable future. And you know, this report, the work of both Professor Clarke and Dr. Kavanagh, is a real contribution to that whole debate. But you know, and that it shows, I suppose, where we are in terms of our EU 14 peers. But then it's putting it into practice. It's how we actually go about it. Now, in the last couple of years, the government has actually given us, you know, it has, let's say, not exactly challenged itself in terms of progressing the SDGs or using the SDGs as a framework in which to develop policy. But what it has given us in the last number of years is a well-being framework. So we're looking at, in this part of the presentation, the SDGs through that lens, through the lens of the government's own well-being, and where these different SDGs, where these goals sit within the context of the 11 dimensions there. So our arching vision and goals for the wellbeing framework was updated just last year. For those of you who aren't aware of the history of it, I'll be very brief. Back in 2020, or with the publication of Budget 2020, there was a consultation document essentially on a wellbeing framework and what that should contain. And there was a lot of work done by an interdepartmental working group placed within the Department of the Taoiseach, as well as with the National Economic and Social Council, or NESC, in terms of what those dimensions should look like, what indicators should come within each of those. And within that, I suppose, the overarching vision then was developed as to what we actually want wellbeing to look like for Ireland, what we want to achieve with all of that. Following some further consultations early last year, that was then updated. And what we have now is this. So this is, as I say, that the vision and goal for what we want to achieve as a society, as an economy, and in terms of the environment. So we want to enable people to have purposeful lives that support good physical and mental health, enabling the development of skills across the life cycle, and providing a good standard of living. Now, obviously, you know, you could unpack a lot of those terms, like what determines a good standard of living? What is, you know, good physical and mental health? Are those items, those definitions different for me or for you? But again, just as an overarching vision, I think we can all agree this is a step in the right direction. We want to ensure a sustainable sense of place, including an appropriate and safe place to live, and protection of Ireland's environment, climate and biodiversity. Again, a really positive move in terms of putting the environment and climate and biodiversity front and centre of an overarching policy framework. We want to preserve balance, inclusivity and equality of opportunities across society, with open and effective government, empowering families, friends and communities to grow, connect and meaningfully engage. And again, for those of you who may have been tuned in to the protests over the weekend, inclusivity, diversity, inclusion, equality of opportunities, that has become a real focus point in terms of policy debate and what that actually means, and what it means to enable that, what it means in policy terms, in monetary terms, in terms of the economy, to support real and proper inclusivity that makes sure that no one is left behind, which is again an overarching tenet of the SDGs. Putting that framework into practice, we saw again last June, the government had published a wellbeing dashboard. So this is essentially understanding life in Ireland, and what the government have determined based on the indicators it is using is I suppose the current position of the wellbeing framework. So you'll see there's kind of a traffic light system. There's green means go. In terms of positive progress, there's red for negative progress, and then white is neutral progress. It's somewhere in the middle. And you can see, based on the government's own interpretation of the indicators that are there, we're doing extraordinarily well. One that really pops out for me. And again, it's a, you know, for anybody who's ever read a newspaper in the last 10 years, is the housing and the built environment indicators. So these are the 11 dimensions here. And we're doing really well, not alone in terms of progress towards that framework, but also in terms of sustainability. Now, Professor Clark referred to the Social Progress Index in his presentation. And if you were looking at the various different kind of sub-indices under that, we rank 63rd on the world ranking in terms of shelter, predominantly around housing affordability. So it's very hard to tally that type of ranking with this type of dashboard. And in advance of our annual social policy conference last year, we circulated a survey and we asked people within the context of these 11 dimensions, what was important to you? And we had a look at the indicators that were available, those that were available from government departments or for other reputable sources and from the Central Statistics Office. And what we came up with was an alternative dashboard that looked a little different to the official version that was published by government. Here we see that only two areas, two dimensions we're doing quite well, and that is knowledge, skills and innovation. And Catherine has already spoken about our very good record in relation to education, but also in terms of work and job quality. We don't do so well in 5 of them: mental and physical health, particularly in terms of waiting lists, housing and the built environment, particularly around affordability, environment, climate and biodiversity, because there isn't an indicator in the world that will give you a good ranking there, safety and security, which is particularly around indicators such as sexual violence, which has risen dramatically in the last number of years, and time use. And then we're somewhere in the middle for subjective well-being, income and wealth, connections, community and participation, and civic engagement, trust and cultural expression. But putting that into the context of what we're talking about today, what do we need to do to drive this agenda? What do we need to do to put more green on the map, to progress beyond the progress that has already been made? And it must be, must be acknowledged that, we've gone, notwithstanding the fact that you can't exactly compare like with like, we've gone from 10th last year in the overall index to 8th this year. So there has been progress among some of those indicators, but how do we do better as a society within the framework that we have here? Now, I don't propose to go through every single one of these proposals. They're in the document, it's available on the website, but I suppose I'll just highlight a few that really kind of, jump out. And one of the main ones is when we look at subjective well-being, we're really talking about the social contract. We're talking about where we as a society link in with government and link in with the state. What is the social contract doing for us? What are we doing for our country? And when we look at the type of issues that are presenting, when we look at the hospital waiting lists, when we look at the homeless lists, when we look at the crime statistics, we see a social contract that is fundamentally broken, and we need that to be renegotiated. We need that to be engaged with through a process of social dialogue that includes all people, all sectors around the table, because essentially everybody is impacted by policy. So everyone deserves to have a say in policy. And that goes from, the very high level macroeconomic policies to things like buying a loaf of bread. You cannot buy a loaf of bread or a bar of chocolate without being impacted by policy, whether through the VAT rate, whether through the ingredients, how those ingredients are presented, how the nutritional information is placed on the wrapping, what it's wrapped in. All of that is a matter of policy. So every single one of us is impacted, therefore we all deserve a say. When it comes then to physical and mental health, we need to start looking at a national level in terms of food poverty. So we're looking at SDG 2. We need to think in terms of the Hot School Meals Programme, for example. At a local level, we need to look for research and local initiatives around sustainable farm to fork food production. We also, at a national level, in terms of good health, we need to reduce our waiting lists dramatically. And they have increased actually by 47% since 2016. And that is not a direction we need to be going, particularly in light of the ever-present COVID-19. And, you know, what we're going to see is more pandemics. It's no longer the if, but the when. We need to have a robust health system that can prepare for that. We need to have it properly accounted for. So in Budget 2023, we saw an allocation that looked really high. It was over €1 billion to our health department, an additional allocation of €1 billion. But when you look at that in the context of IFAC, the Irish Fiscal Advisory Council, and their report that said it takes 900 million just to stand still, taking into account of existing levels of service and demographic change, that 1 billion is really insignificant if we want to make the dramatic and much needed changes in terms of things like mental health supports. We saw the CAVS report and what, you know, the waiting lists, the children being left behind. If we want to see a statutory right to home care that was promised for introduction in early 2021 actually come to fruition. If we want to see primary health care that engages with the community, that is a real support, that takes the pressure off acute services. And if at an acute service level, we want to stop seeing people not only waiting for beds, but waiting for trolleys on hard plastic chairs. So we need to be realistic about the budget there. We need to implement all stages of the dementia strategy, all stages of sláinte care, and make sure that we really are supporting people where they are at on the basis, as we did in the COVID pandemic, at the basis of their need rather than on the basis of their ability to pay. In terms then of income and wealth, we need to provide for, and this is something that we've been out with last week, my colleague Suzanne, who's in the audience today, was on radio last week talking about the fact that we and every other civil society organisation called for at least €20 of an increase every week in core social welfare rates in budget 2023. What was given was €8 a week. That is actually a reduction in real terms in terms of what you can buy with your social welfare. So we're calling on government again to make that difference. We're going to see a cost of living announcement tomorrow, and part of that should be an increase in core social welfare rates to bring it up to the €20, which would just about cover inflation, let alone actually what you need for a reasonable standard of living based on any of the other metrics, for example, the minimum essential standard of living from the Vincentian Partnership. In terms of knowledge and skills, you know, we need to improve educational disadvantage. We need to improve those outcomes for kids that are currently going through DEIS schools. Yes, DEIS is having an impact and is having a very positive impact, but there are people who are being left behind. We have children who are and I don't like the term school refusal, but we have children who are losing their places in school because they can't keep up, not through any cause of their own, but because the systems and the supports just aren't put in place, and we need to do better by them. If we are to have a better future generation, then we need to have the right educational placements in place right now. Catherine also mentioned in her presentation, we don't do so well in terms of lifelong learning. And this is something that's really important if we're to be this dynamic economy, if we're to take, you know, control of our destiny in a much more globalized environment. You know, if we want to ensure that we're keeping pace with changes in the way of work, then we need to make sure that we are training people, that we're supporting people through their entire life cycle to be able to adapt to what is necessary and to new jobs and responsibilities as they come down the line. In terms of housing and local area, where do I even begin? We need to, in terms of the poverty aspect of it, we need to protect people from homelessness. That includes people who are currently in owner-occupied accommodation, but who are up to their eyeballs and beyond in mortgage arrears. That is an issue that is only going to get worse with the current cost of living crisis. So, you know, we proposed last year the introduction of an equity scheme for borrowers in long-term mortgage arrears. And we would still make that proposal. We engaged extensively with both the Department of Housing and also the Department of Finance and with the central bank. And we would like to see this progressed if we are to avoid having an increase in homelessness. We'd like to see the provision of housing first accommodation extended to families. So it's not just in terms of vulnerable adults who may have addiction or mental health issues, but actually for families who require wraparound services, not just for their kids in terms of occupational therapy, physical therapy, speech and language therapy, children who are not able to walk or crawl because they don't have the space to do it, children who aren't getting their nutritional needs met because their families don't have places to cook for them. We need to have a real conversation around the developmental aspect of all of that, but we also need to take care of the parents in all of this. You know, when we talk about things like poverty in Social Justice Ireland, we talk about it at a household level. There's no such thing as child poverty in isolation from household and familial poverty. We need to address the needs of the entire family. We need to make sure that parents are supported to support their children, and that requires wraparound supports for those who are homeless. We need to set a target of 20% of all bills, all of our housing stock to be social housing. This is something that we are continuously being told is just too, it's too expensive to do. We saw an Oxfam report earlier this year that suggested if we had a relatively small wealth tax imposed on very, very, very high net worth individuals, that we could have achieved gathered another 8.2 billion euro. There's so much that could be done with that in terms of making sure that we have accommodation for everybody who needs it, so that we don't have people who are fleeing persecution, sleeping in tents, sleeping rough, that we don't have families accessing one night only emergency accommodation, that we don't have people in accommodation, certainly in their older age, where they still have outdoor toilets, where they've leaking roofs, that, you know, we are actually making sure that our accommodation is up to standard, but particularly for those who are most vulnerable. In terms of environment, climate and biodiversity, and we see, you know, SDG 6 and SDG 7 for a start, you know, to provide support and advice to farmers to improve their water quality, and at local level to develop a drinking water safety plan under the EPA guidance. In terms of renewable energy, and this is something that's really at the kind of tipping point at the moment, to upgrade the national grid and invest in infrastructure to support renewable energy, particularly offshore wind, and invest in the necessary research and development for the use of renewable energy in our public transport systems. And then at a local level, to invest in renewable energy transitions for local authority offices and community spaces, but also for local authority accommodation. We also need to introduce the circular economy package for Ireland to ensure that, you know, all areas of economic activity are thinking circular in terms of their means for production. We need to invest in short supply chains. We need to reintroduce the windfall gains tax at 80% in terms of speculative land. Yes, there are discussions in relation to implementing a vacant house tax or a vacant land tax, but as we're seeing in various different reports, it isn't enough. It's too little too late, and there are too many gaps in it to allow land hoarders to actually get out of paying the tax at all. At a local level, to eliminate all single-use plastics from local authority buildings and public spaces, to develop open consultation and ambitious waste management plans, and to adopt the principles of a circular economy for construction and demolition waste. In terms of there's other areas obviously there as well, but life on water, to fully implement the National Integrated Maritime Plan, life on land, to increase afforestation of native species. So not just the planting of Sitka spruce, but to actually rebuild the biodiversity loss that we have seen through this kind of mass management of Sitka spruce afforestation. In terms of safety and security, to abide by our commitments under the Istanbul Convention, to actually make sure that there are the measly 472 spaces that we are obliged to have, but actually to show a bit of ambition and go above and beyond that to make sure that that families, that women and children, and it is usually women and children who require the supports of domestic violence refuges, that they have those there, that they have a safe space to go to. And in terms of reducing our inequalities, to make sure that the Commission for the Elimination of Racial Discrimination, those recommendations are properly implemented. And we very much look forward to the publication of the strategy to end racism, which we hope will be published within the next number of weeks. In terms of work and job quality, to implement a refundable tax credit system to support those who are working poor. We have roughly 90,000 people who are in employment, but who are earning an amount below the poverty line. And to just, it's not going to solve their poverty crisis, but it will actually support them a little bit, as if they could avail of a refundable tax credit. So any tax credit that they don't use because they don't earn enough to use it is given back to them at the end of the fiscal year. And to launch a major investment program focused on prioritizing initiatives that strengthen social infrastructure. So that whole idea of building back better, to build social infrastructure, to build things like proper schools, proper roads, proper healthcare, proper social housing, that creates local level employment. But so then you're contributing to the economy. In terms of time use, it's really important to recognise that the term work is not synonymous with just having a paid employment or a paid job, to recognise the value that is being contributed every single day by parents who work in the home looking after their children, by adult children and carers who are looking after their siblings or their parents, that is a major contribution to the economy. If you were to pay for that privately, it would cost billions. So to recognise the value that is, that these are people who get up very early in the morning. And for those of us who have ever had young children, very, very early in the morning and several times during the night, and that contribution should be valued. In terms of community, social connections and cultural participation, again, to really invigorate the national economic and social dialogue, to make sure that it isn't just about employment and trade union membership, but it is actually civil society, that it's environmental groups, that we all, again, have a say in shaping the policies that impact on all of us. And finally, then, civil engagement and cultural expression, to tag all government policies and policy proposals with the relevant SDGs, to make sure that we have this front and center. We have the bag of words in terms of our well-being framework, but we actually need to use it. We need to make sure that we are seeing the transformational change that is required at a policy level to bring this and to make it relevant. And to increase our ODA as a percentage of GNI. So Catherine already referenced, we're at about 0.3% of GNI star. We want to see it up to the UN target of 0.7. That is exclusive of climate finance. So it's not including climate finance targets, and it's not including the COP27 commitments in relation to loss and damage. And with that, I will hand back to the panel for questions. Thank you very much.
Thank you, Colette. And I think as we could, that's the three presentations, the full report, in fact, now presented. And I just want to, I think everybody will agree that we've got three terrific presentations. And I want to say a very sincere thank you to the three C's, Catherine, Colette, and Charles. So thank you very much. There have been a number of questions and answers. We've been answering them as we go along. There's still quite a number. But if I might start by raising a couple of questions that I think might, and maybe we could take a little bit of a few minutes extra to go further or push further the implications. For example, when you look at the top third, you know, if you break the 14 countries into the top third, the middle third, the bottom third, Ireland gets into the top third on only 3 SDGs. Now, as Catherine pointed out, and like that's quality education, we're ranked for 1. Good health and well-being, we're in 5, and sustainable cities and communities, we're at 3. So those 3 SDGs are the only ones in which we're in the top 5. By contrast, we're in the bottom 5 on 9 SDGs. So it seems to me that that's saying something to us, and it's a very powerful something in a way. Now, Colette has been spelling some of that out, but I was just wondering, do others want to, Charles or Catherine, want to say anything, or if Colette has further more, because I know she was very constrained by the time. So just any comments you might have on that sort of the implications of that finding or those findings.
Well, I think it's definitely well worth pointing out, Seán, that we are comparing our countries. First of all, we're comparing Ireland to our peers. So, if you took a different group of countries, we'd probably look a lot better. There's no denying that if we were to look at all the EU 27. But I think the merit in what we're doing is that we're looking at countries that are kind of doing similar things to us in many ways, and that, we're at a similar stage of development. And really, as Charlie pointed out, I think, what it suggests is that there are obviously some countries that are doing things a lot better than us and more effectively, more efficiently, that they are certainly, managing to get closer to achievement of the goals than we are. And perhaps there's lessons to be learned for us in that. I think that's very important.
Good. Anybody else want to say anything, or we move on? Okay, let's move on.
Sorry, just to say, I think I completely agree with Catherine. I think, the I suppose natural progression to this is for the countries that we are lagging behind. What are they doing that we're not doing that we could see being implemented and introduced? And I mean, we talk about the kind of Nordic countries quite a lot, and we look at Finland, for example, around homelessness. We look at Finland in terms of media literacy. We look at Finland in terms of education. Like they do a lot that is really, really good, and it's around. It's not even things that require a huge amount of spending. It's actually around the policies and how those policies are implemented. So there's definitely a lot that we could learn there.
And I think, just to take up the point that maybe Catherine made, that I think we in Social Justice Ireland are very strongly of the view that there's not much point in comparing our performance with countries that have a much lower level of income, or their socioeconomic status is much lower than Ireland. It's much more sensible to really measure out how we're doing, is to measure us against our peers, and that's what this study has been doing from day one. And I think it has a serious number of points to sort of respond to there, if you like. So let's get on, because there's a number
Actually,
of...
Seán, can I just come in on a comment there? Because I think you've raised something interesting, and it came up in one of the questions there that I addressed earlier. And it concerned, like the Sachs report, Jeffrey Sachs and his group of colleagues that I mentioned. And if you notice, and remember, Ireland was ranked, we were green on no poverty, so we've achieved that goal as far as, the Sachs report. But the interesting thing about the Sachs report, remember, is that, first of all, they're looking at 193 countries. So it's all of the less developed countries, including Ireland. And they rank Ireland at ninth place out of 193 countries. And the reason is because they're using different measures of poverty. And they have to do that because these measures of poverty are ones that have been defined by the UN, the global indicators. So, for example, they're measuring poverty at people who were living on less than $1.90 a day. So you can see, those measures will obviously put the developed countries in a much better placing on certain items, certain indicators, and that's what's happening with the poverty one. Whereas when you compare Ireland relative to the EU 14, it just paints a different picture. Our version of poverty is clearly very different to what versions of poverty would be important in developed country or developing countries. So I think it's important to emphasize that point, maybe.
Absolutely, and I think there's always this danger of Ireland being seen, presented by some as doing tremendously well on poverty.
Yeah.
Although, while we've made some progress,
yes,
the reality is that there's still a very extensive level of poverty in Ireland. the latest poverty numbers will be published in a couple of days. We're not going to see any progress there. And it does say something quite serious about our intention. Is it okay as a country for us to have that level of poverty and basically not be taking measures to actually reduce it? Charlie, did you want to say something on this one? Or will we go to the next question?
Well, just a quick comment on, our group of 14 are also in the same currency zone and the same regulatory zone for most part. And that's important to keep in mind. In many ways, our analysis is close to what we would do in the United States, where we compare the 50 states, because they're all in the same currency. And when you start going to different currencies and different regulatory environments, you're going to end up with different ways of measuring things. And so I think, expanding the group too much would lose the clarity of the analysis.
Perfect, I think, Charles. So, question from Norma Burke. Do you have specific asks to reduce hospital bed problems? Do we need to plan for a universal national health service free at the point of access, as in the UK, or is Sláinte care not enough to meet the challenges?
To Charlie.
So, I think you want to.
I'm not an expert at all on the Irish healthcare system, so I'm not going to venture.
I think if we could implement Sláinte care, it'd be a start. Like it's 2016, and we're very little down the pike on it. I mean, it was to cost 2016 levels, 3 billion in terms of infrastructure. It was to be brought in 500 million a year for 6 years. We saw that once during the COVID years and then never again. So, we've a huge leap to make in terms of just even getting that right. Would I like to see a universal health system where it's free to the point of use so that you can actually access it for those who need it? Absolutely. Notwithstanding the fact that the NHS isn't the be all and end all. I mean, it has its own difficulties, certainly. And certainly even in the UK, there are, private insurers and people with more resources will get better quality of care. But certainly if we could introduce, or if we could implement Sláinte care in the way that it was intended to be implemented, if we had proper primary care centres and community healthcare networks, if we had proper primary care beds that could ease the burden on the acute services, it would go a long way to making our health system that bit more equal. And then from there, we could decide where we wanted to go. But I think we're so far behind that type of a system at the moment that we need to implement the policies that have already been agreed. Absolutely.
I think there's an issue about, we talk about Sláinte care, but it's a bit like you were saying already, Colette, that there's a lot of the rhetoric is in place, but the actual doing of it is another story altogether. We're a long way from implementing Sláinte care. The other issue, I suppose, is that we have been moving slowly, very slowly, but in the right direction in the context of the basic building block, which has to be in the community and the sort of primary care and so on. And at least that's moving in the right direction, but it should be moving at a much faster pace, because we have so much at the moment, so much of the health system is basically driven around people going to access emergency departments, as they call them now, as the sort of point of entry, which doesn't actually make any sense in the context of an overall health system. But anyway, I won't go on, because people know who know me know I could go on about this for too long, far too long. There's a question here from Catherine Carthy. Do we have enough disaggregated data across sectors to determine how life in Ireland is for those furthest behind? The lived experience would paint a different picture to many indicators.
Yeah, I'd absolutely agree with that. It certainly would. But I suppose we are restricted with data availability. And I think that's so clear. We've been doing this quite a long time now, myself and Charlie and Colette. And, I mean, I suppose you would have expected that there would be a little bit more disaggregated data available. Now, certainly, you could probably consider doing something in Ireland and see what might be available at sectoral level, but then you wouldn't be comparing across countries. And I suppose the benefit of what we're doing is trying to kind of see how we're doing relative to other countries. And I think that's useful. But certainly, I mean, God, if we had disaggregated data, we'd love to be able to see exactly, you know, where are the problems, what regions, and you could certainly design a lot more targeted policies, I would think, on the back of that, you know.
In order to do that, that demands resources as well.
Yeah.
Like we've called, certainly on the silk data, so that where we get our poverty and deprivation data, we've called for a larger sample, because once you have a larger sample, you can drill down to the county level. At the moment, it's only on regional or national. But again, that requires resources for the CSO to go and do that, and those resources haven't been given.
Eurostat has been developing breakdown of many statistics by region, and Ireland only has 2 regions, so it's not very narrow. It's basically around Dublin and not around Dublin, the 2 regions.
Okay, a question for Professor Clark. You've answered it in the chat, but I think I'd like to hear your answer. And that is, what is your take on the recent growth indicator showing that Ireland's economy grew by 12.2%?
Yeah, whenever you see numbers, I mean, 2015, I think it was 25.6%. You know, if one of my students had that as an answer to a test, I'd give them extra help. That's just so out of any lived experience. You know, if you're China, 10% in the developing phase is one thing, but you know, Ireland is not building roads for the first time. So it's clearly anything over 6-7%, unless you're like shut the economy down and then that's the year you open it up, is going to be because of some sort of accounting. And we've seen that a lot of this accounting is foreign companies using Ireland as a way to avoid taxes. And you know, it's
no surprise in that response, but that's the context, that's the reality. A good question here from Megan Carmody. For each of you, what's the one thing that needs to happen, or what would be your priority, the one thing to happen in order to move from the SDGs being a nice to have parallel process to being the main driver of government policy? Now,
Transformational change. You know, we need to go from it being a very economic driven political process to it being a societal driven political process. So, you know, we have the SDGs, we've signed up to it, we were one of the key drivers to it. We have a well-being framework. We have all of these lovely tools, and then we put them away on a shelf and that's it, that's done. They're not being brought into politics. They're not being brought into any sort of policy discussions. And that's the thing, that's where they need to be. If we're looking at, you know, how do we reduce poverty? How do we go from what is currently 595,000 people to 0? We need to look beyond income distribution and the Department of Social Welfare. We need to look at health. We need to look at housing. Similarly, if we're going to look at, you know, we need to see the interconnection. So if we're going to look at housing and we look at 3,000 children who are accessing emergency accommodation in a given week, in a given month, that is, they're not the real homelessness numbers. If we're going to look at that, we also need to think of, well, if they don't get what they need now out of the Department of Housing, they're going to be presenting in the Department of Health. They're going to be presenting in that budget. They're going to be presenting in the education budget in terms of day schooling or additional supports. So we need to think in an integrated way, and that requires that transformational change. There is no point in constantly thinking 5-year cycles, departmental only. It needs to go across intergovernmentally.
Okay.
I'm going to jump in here.
Yeah.
I first got interested in this field when one of my former students invited me to an event at the United Nations, and it was on pro-poor budgeting. And what they did is they went into these villages, and each group gave a presentation. Then they all had like the lowest amount of currency, like coins, and then they voted on where the budget should be spent. And all of a sudden, sanitation got to the top of the list, when it was on the bottom. And, you know, you really started to get an allocation that reflected what people actually wanted. And I think the transformation is getting people, getting the bottom level of everything, people involved and have their voices start to be heard and to actually impact on what are the choices society makes. Because I think most of the SDGs would be in line with what people want for their lives.
Absolutely.
That's where a lot of them came from. Another one of my students ran the social media campaign for the SDGs, and the outreach and a lot of what we ended up with came from what people were asking for. So
Good. Okay. If I might throw in my tuppence worth, I would reiterate what Colette said earlier on. For me, the one thing that I would see, there's two sides to it. It's basically, we need to acknowledge that the social contract in Ireland is broken. We need a new social contract, but to deliver that, we need a social dialogue that involves everybody in a really serious way. And just to make the point that particular question was asked by Megan Carmody, who anchors Coalition 2030, which is a huge coalition of organizations across many sectors who are focused on implementing the SDGs and making sure Ireland makes progress in that direction. I'm under pressure here because we are over time. There are a number of other questions, unfortunately, we are not able to get to. We've done we've sort of crammed as much as we can into the time that we have available. We've probably stretched that a little bit too much, or beyond its official close time anyway. So I just want to say a very sincere thank you on behalf of Social Justice Ireland to Dr. Catherine Kavanagh, to Professor Charles Clarke, to Colette Bennett for doing the work again this year. And just to assure everybody that we will be continuing this. On the one hand, we will be trying to use the results that have been produced this time to see if we can have an impact in one form or another on the policy process, which at the end of the day is what it's all about. And on the other side, we will intend to continue that. And just to say a special thank you to Professor Clarke, who's beamed in from New York and was online here this morning at his time. It would have been about 7:30 so in the morning. So a serious effort to be organized and at that time of the day. So to everybody, thank you for being here, for attending, and thank you for again showing up to Social Justice Ireland's events and whatever. And we have more of these. Just keep an eye out on the website all the time. And the actual video of this will be appearing very soon on the website. The report is already on the website if you want to check it out there or download it, whatever. So a renewed thanks to Catherine and Charles and Colette. I think we can close the event